Hello all. Again, I welcome to all of you. He is Dr. Ashish and I welcome to all of you on my YouTube channel. First of all, thanks for supporting, thanks for liking my videos, thanks for subscribing my channel, thanks for commenting as I am getting personal mails. Again, this video, we are going to talk about something different, and in this video, we try to catch why a particular medicine or a particular personality behave that way. Like if you go through the repertory in mind section, you will get a rubric changeability. Most of we just stuck to a remedy like pulsatilla. So whenever we see changeability in any patient, we try to manipulate the patient, or we try to put the leading questions regarding related to pulsatilla, because of lack of knowledge, because of lack of repertory knowledge. Even we just stuck to just like pulsatilla. Like whenever you see changeability, you see pulsatilla. You try to see pulsatilla in the patient, or you just try to mold that patient. You try to manipulate the patient in pulsatilla way. So that is the biggest mistake we generally do in our day-to-day practice. Second, whenever we see a patient which is dirty, which is filthy, so we are just try to we just make an image of sulfur. But if you go through this rubric, there are many medicines. If you go through the changeability, there are many medicines. So every medicine has a journey. Every medicine has a journey why the patient is changeable. Before changeability, there is a journey, and after changeability, there is a journey of that medicine. So that journey will decide that medicine, that patient is pulsatilla or any other medicine. So same here with whenever you see fastidious, you just think about nux vomica, arsenic album. But when you go through the this rubric, there are many medicines along with pulsatilla and along with nux vomica and arsenic album. So this is a common mistakes we do, and this mistake occur because of lack of knowledge, because of lack of we just read a medicine, we just learn, we just remember a medicine in a particular shade. So that is why I just prefer to remember any medicine with with mind rubrics. So that is the exact way to draw a whole personality of that medicine. So that is the first. I request, uh, if you go through my opium medicine as I described in my videos, you if you go through, that is the most viewed video so far in my video list. So if you go through this that video, you will try, or you will see how a medicine change the personality, how the medicine react a particular shade, or how a medicine will react in a way. So that was the just a request to all of you to read a medicine by repertory, or try to link rubrics so that a proper personality can be drawn. So that was the now I come to the another point that is more important. And I was going through a medicine, and very surprisingly, that medicine is very many things we need to know about that. About I'm talking about a medicine which is very commonly known, or which is very frequently used in our day-to-day practice, and many times most neglected also, because this medicine shows like normally this medicine is known for a businessman medicine, businessman remedy. So I hope you can reach, or you can imagine that with me what medicine I am talking about. But if you go through the repertory, just if you go through the repertory, and I put the medicine, and one I extract the all rubrics. This medicine is in activity desired for. This medicine is in industrious. This medicine is in mm, this medicine is in many rubrics which the medicine cover, which is Anxiety bed, driving out of bed. uh, Anxiety business about. Anxiety do something compelled to. Anxiety driving from place to place. Anxiety in bed. So, or when you encounter this patient's behave, this patient's attitude is just like a businessman. The patient will bargain, the patient is avarice, the patient is in avarice. And most surprisingly, this patient is passionate about to earn money, to preserve his health, or whatever the patient have, that he will try to preserve, he will try to save that asset. So that is why, as far as the money is concerned, the patient will try to preserve his money by bargaining, by a average behavior. And also, the patient is in alcoholism. The patient is in like that patient is not don't want to take rest. The patient want to do work more and more, more and more. This patient is also in. If you go through the desires, very surprisingly, desire. mm, if you go through the rubric desire, there are lots of rubrics like desires, full of desires, desire full of indefinite desires, desire full of desires more than she needs, desire full of desires, present things not, and desire full of desires, unattainable things desire for. Like, so, in short, I will try to explain this medicine in a line that I think a line will suit this medicine properly. That is, I need more. I don't. I want more. I want more than I need. I want more and more, more and more. Nothing can be satisfied me. Again, if you go through the repertoire, this medicine is in discontented. Discontented means the patient is not satisfied what the patient have. The patient is not satisfied with what asset the patient have right now. Although the patient has crore rupees in his account, again the patient want to multiply this money more and more. Then patient want to earn more and more. So why? So this is the main reason, because of or very surprisingly, this medicine is not in ambition. So that patient has not a ambition to make money 50 crores, 100 crores, 10 crores, 20 crores. Now the patient don't have a particular goal, like I have this type of bungalow, I want this type of car. Now this patient is not in ambition. So why the patient is behave that way? Why? And when you try to catch this, why next vomica is fastidious, why CPI is indifference, why arsenic is fastidious, why Merck is dictatorial. This is the basic reason, or this is the basic question you should be thought of in your mind. And when you think why, you will go through a journey before and after, and that journey will clear the medicine very very easily, and you can easily catch the personality of your patient of the medicine, and you can easily select the right remedy, because of you know what is the journey of arsenic, what is the journey of snaxomica, what is the journey of uh, other medicines. So this is the medicine. So now, very surprisingly, this medicine is in discontented to everything, discontented with himself even. Or this medicine is alcoholism. Alcoholism is what? Alcoholism means what? The patient has a passion to do work like a alcohol, like the patient has consumed alcohol. The patient is in like alcoholic. That level of passion to work. So this patient is dishonest even. To earn money, the patient can be dishonest. The patient is in disturbed aversion of pain. Whenever the patient is getting disturbance, the patient will get angry. The patient, so there is a aversion to disturb. The patient is in. There are many rubrics which relate fear, business, failure of. So the whole journey of the patient is in business. So why the patient is behave that way? So two rubrics will define that medicine very clearly. Two rubrics only. As I go through the whole mind rubrics of that medicine, I will try to catch, or I will try to find that why this medicine behaves that way. Why that medicine has a passion to earn money. Why that medicine has a passion to earn more and more, or make more and more. So there are two reasons. This medicine is surprisingly found in fear, poverty of, and delusion poor of. Fear, poverty. Whatever the patient has a fear to lose that, and whatever the patient have, still the patient is thinking he is poor. That is why the patient has tried. The patient is all time the patient will try to manipulate multiply that assets or multiply that what the patient have, and that is why the whole journey or the whole rubrics, the whole personality will happen, well, whole mentals will happen in the patient's lifestyle. So that was the I was talking about the bryonia alba. Go through the repertory, go through the rubrics. You will catch or you will get that what is the journey of bryonia. Because surprisingly, the bryonia is not in ambition. Ambition for like mm, ambition increased. Like if you go through the ambition increased, there is no bryonia. Again, there is a ambition increased competitive. There is no bryonia. Ambition increased fame for. There is no bryonia. Ambition increased means employed every possible. There is no bryonia. And ambition increased to make money. There is no bryonia. So why the patient has the patient to make money? Because there is no ambition. Because of the fear. Why? Because of the fear, the patient has an had delusion that the patient is poor. Because of the fear of poverty, that is why the brainer will try to make money every time, will behave that way to reserve money, to save money. That is it. So that was the whole a shade of brainia. I will try to explain. If there's any question, you can just ping me on my social media handles. Or one more thing I would like to say that we are just going to start a free basis every Tuesday basis classes of to share case, to discuss medicines. If you want to be the part of that classes, that is absolutely free, and many of doctors has joined also. Message me personally. You can contact me on my social media handles, and you can mail me also. I will provide the link of that classes, or the group of Telegram group. Be the part of that, and definitely you will get the new thing. Or thanks for liking, thanks for subscribing, or thanks for keep supporting. Thanks for this support. All right, मिलते हैं next video में. See you in next video with a new thing, with a new journey, with a new medicine. In this video, if you have any question, if you have any query, you can ping me on my social media. Vande Mataram.